If you're thinking about getting breast augmentation surgery, asking the right questions is one of the best things you can do to make a confident and informed decision. I'm Dr. Tiffany McCormack, a board-certified plastic surgeon, part of Reno, Tahoe Plastic Surgery and world's leading clinics. Today I'm going to share the top 5 questions that I get as a plastic surgeon from patients seeking breast augmentation. What implant size is best for me? That's the most common question that I get in patients seeking breast augmentation surgery. I think it's twofold. One, what are you looking for? What are you hoping to look like in the mirror? And some of that will determine by using physical sizers in front of the mirror. So the patient can really say, yeah, this is the proportion I'm going for, this is the size that I like, or this is the range that I'm looking for. The second determination comes from what your body shape and physical characteristics are. So what is the base width of your breast? How much of your own tissue do you have to cover a certain type of implant? And once we determine that and put that together with the vector imager, then we can go to profile of the implant. Different implants have different profiles. So some are high profile, meaning that they have more projection, less width, less height. Some are low profile, meaning that they're wider and taller with less projection. And then we have everything in between. So matching what the patient's looking for and what their ultimate goal is with what their physical body will naturally hold, if you will, is what all comes together during the consultation. Should my implant go over or under the muscle? Both are viable options, but some of that depends on what you're looking for. If you have very little breast tissue and you're looking for a more natural result where you don't want to necessarily see the edges of the implant and you want more of a teardrop shape, then going under the muscle is probably the right choice for you. If you're looking for something that you won't really feel when you're trying to work out a lot and you're very physical with your arms and your chest and you have a lot of breast tissue to kind of cover the contours of the implant, then going on top of the muscle is probably okay. I think having a discussion with your board-certified plastic surgeon about what your goals are and what you're looking for appearance-wise and how natural you want that result to be, again, depending on your anatomy, all of that can be achieved either way. What is the long-term maintenance with implants? First and foremost, with my patients, I do like to follow them. I like to do an ultrasound at no later than 4 years just to check the integrity of the implant, and then I tell them every 2 to 3 years after that we should be looking at it again. I think no medical device lasts forever, and breast implants are not an exception. They don't last forever, and some patients are surprised to hear this, especially those who come in and they've had them for 30 years and were never told that they had to have them replaced. I do tell them that over time, the shell of the implant gets weaker, and so it just gets more susceptible to rupture as it gets older. So we should be, following you and monitoring those implants over time, but also talking to patients about the fact that maybe at 20 years, it's time to think about having them changed if you haven't before for other reasons. If I get a breast augmentation, will I need a breast lift too? It depends. I have a set of patients who come in where absolutely they do not need a breast lift. Everything is tight and perky and exactly where you want it to be, and you just want to volumize where the breast is currently sitting. I have other patients who are really saggy, and if I don't do a breast lift, one of two things can happen. One, we call it a rock in a sock. The implant kind of sits at the bottom of where the breast is, and I tell the patient if you like where your breast is and you like the shape of your breast and you just want to make that bigger, then maybe an implant will do that for you. But most of those patients say, no, I actually want my breast up here, I want a different shape, in which case a lift is going to be necessary to achieve that. And then I have some patients in between where they have the option. You can get a nice result by just augmenting the breast where they are and where they sit, but when I ask them very specifically, what do you want your breasts to look like? Where are you happy with where they are? Are you feeling like you want them a little more perky? And there's some maybe stretched out skin, maybe they've had some kids or some weight loss or both, then a breast lift is in order to achieve the shape that they're in particular looking for. How will my breast implants affect mammograms or breastfeeding? When it comes to mammograms, you can certainly still have them with implants in place. However, they may take extra views or use different kinds of imaging to really get a good picture of the breast tissue. Whether your implant is under or over the muscle, all of that breast tissue is still sitting on top of the implant and more superficial. So they're still able to visualize that with mammogram, and you're also still able to really feel your breast tissue when you do your self-exams. When it comes to breastfeeding, it should not affect breastfeeding. Sometimes with a breast lift, you can affect the breastfeeding, but just an implant alone should not affect breastfeeding. In a small percentage of patients, maybe it will, but it's not very common. When choosing your doctor for breast augmentation, it's important to go into the consultation with your questions ready and make sure that that doctor can confidently answer your questions. It's important to look at before and afters. It's important to be able to discuss what your goals are and to be able to communicate that with the doctor and make sure that you're heard so that you can be on the same page and achieve the outcome that not only your doctor is happy with, but you're happy with. To learn more about breast augmentation, visit worldsleadingclinics.com.